I want to update you again on our current status today. Once again, I'm saddened to report that we have 11 additional deaths today. 9 of the people who passed are over the age of 65, and of those who died who were over 65, 7 people had underlying health conditions. The other 2 deaths occurred among people who were younger. One person who was between the ages of 18 and 40, and the other person was between the ages of 41 and 65. Both of these people had underlying health conditions. This brings the total number of deaths to 65 in LA County, and our mortality rate for COVID-19 remains at 1.8%. 88% of the people who are positive for COVID-19 and have died did have underlying health conditions. But as I've noted, some people who unfortunately have lost their lives do not have underlying health conditions. Every day reporting these numbers is devastating, and I know it's more devastating for the lives of the families and friends who've experienced this tremendous loss. I'm so very sorry for your loss, and I want you to know that we all keep you in our thoughts and prayers. Today, we're also reporting an additional 513 new cases. That means over the last 48 hours, we've announced over 1,000 new cases, and the total number of cases here in LA County now stands at 3,518. These cases include 133 cases reported by our partners in the city of Long Beach and 33 cases reported by the city of Pasadena, which, as you know, have independent city health departments. We're also confirming today that we now have 5 cases of people who are positive with COVID-19 amongst people who are experiencing homelessness. 79% of all of our positive cases still occur among people between the ages of 18 and 65, and this number remains constant since the beginning of the outbreak. In terms of hospitalization data, to date, 733 people have been hospitalized at some point during their illness, and that amounts to now 21% of all of our positive cases. Today, there are 341 people who are hospitalized for COVID-19. 210 people are 55 and older, and 141 people are over the age of 65. 76% of the people who are hospitalized today have no documented underlying health conditions. So again, I want to stress that people in the hospital are dispersed amongst all age categories, and there are a significant number of people who are requiring hospital care who do not have underlying health conditions. So this disease does cause, in fact, serious illness amongst people of all ages. And everyone should take seriously the fact that they are at risk, not only for illness from COVID-19, but potentially for serious illness, even if they're not falling in one of what we've been referring to as a high-risk category: people with underlying illness, people who are over the age of 65, and pregnant women. Currently, 20% of people who are hospitalized today are in the ICU, the intensive care unit, and 36% of those in the ICU are 65 years old or older, and 55% of people in the ICU have underlying health conditions. 4 people in the ICU are under the age of 35. 3 people who are under the age of 35 do have underlying health conditions. You can see an update report of our LA County cases on our Department of Public Health's website. That's www.publichealth.lacounty.gov. I do want to spend a few minutes talking about cases at institutional settings. These are settings that include nursing homes, skilled nursing homes, assisted living facilities, residential treatment programs, shelters, jails, and prisons. We are currently investigating 43 institutions where they have at least one positive case of COVID-19. The total confirmed cases amongst all of the institutional settings as of today that we're investigating is now 207, and that includes both staff and residents. 148 of the confirmed cases are among residents in these institutions, and 96 are staff. We're sad to report that 7 people have died from COVID-19 who resided in institutional settings. The majority of these, they were in 4 different institutional settings, including nursing homes and assisted living facilities and an extended care facility. We will be posting a list of all the facilities that have confirmed cases on our website once a facility has had an opportunity to notify their staff, residents, and families. As I noted yesterday, our DPH teams are investigating at every single one of the sites where there has been a positive case in an institutional setting, and they're working hard to help management and staff do their best to protect the health of all of their residents and their staff, because many of them have employees that also have become infected with COVID-19. And I do want to clarify that while I try to be as transparent as possible and provide as much information as possible, I do have to weigh that with our obligation to maintain, as much as possible, patient confidentiality. So there are some times where I'm not disclosing some information, and it's really because I don't want to risk violating the privacy of a person who's positive. So please understand and bear with us around our limitations on the reporting. I want to do an update on testing as well. As of yesterday, over 21,000 people have been tested in LA County. That's actually an underreport because we have a couple of labs that have not given us the number of people who they tested who they reported as negative. So about 12 to 13% of folks are positive right now who have been tested. But again, I think that number will change tomorrow when we get all of the negative reports in as well. We'll have had more people who actually got tested, and that will bring down the rate in terms of the number of people who are positive. We've seen a lot of big improvements in testing capacity, and I want to really sort of give a shout out to Dr. Kazan and his team and all of the commercial and private labs and hospitals that have stepped up to make it easier for people to get tested. But capacity still is limited, so I ask you to have patience and work with a provider to determine whether or not it's clinically appropriate and medically necessary for you to be tested for COVID-19. We're learning more every single day about this virus, and we're really benefiting from a large group of researchers and scientists that are doing a lot of studying of what this virus is and who's most likely to get infected. But because it's a new virus, and because we're learning more every day, it also does mean that we need to pivot on some of our guidance. And there's increasing evidence, as I noted yesterday, that there are people who are infected with COVID-19 but don't have any symptoms. And for some of these people, there's also evidence that they're able to spread the infection. So they don't feel sick, they don't think they're sick, they have no signs or symptoms of respiratory illness. When they're tested, they end up being positive, and it ends up that they've also transmitted, even though they're asymptomatic, to other people. And that's the benefit we're getting from the researchers and scientists who are able to look back in time and better understand the patterns around disease transmission. This means, however, that even if you're feeling fine, or if you're around people who are feeling fine, you and the other person that you're with could be infected, and you're able to infect others, and others you're with are able to infect you. So more than ever, I ask that you adhere to the principle of taking universal precautions, because we need to assume, even if we're feeling fine, we could be infected and we could infect others. And others who are without symptoms fall in the same category. They're feeling fine, they look fine, but they can still infect you. So staying home and social distancing are the most important tools we have now that we know that asymptomatic people can in fact transmit the virus. And CDC has issued new guidelines for all of us to follow, recognizing that this is now a fact that we need to accommodate when we think about how we're living our lives in these very uncertain terms. So yesterday I noted that CDC had stated that if you're considered a close contact to a person who's positive for COVID-19 or is presumed positive, you can be designated as a close contact if you were with that person 48 hours before they started showing any symptoms. And so we have to think differently about who are all our close contacts if we're positive for COVID-19 or we're presumed to be positive. A doctor has told us we might not be tested, but we should assume we have the disease. Now we don't just have to remember who was I with the day I started feeling sick. Now we have to remember who was I with for 2 days before I started feeling sick. And I've got to contact all of those people if I was in close contact with them and let them know that they need to quarantine themselves for a period of up to 14 days. The second piece of new guidance that I expect that we'll be seeing from CDC later this week is around masking. And I want to talk about that because there's always been a lot of interest in the role masks can play in protecting others and ourselves from transmission of COVID-19. So first, I want to start by acknowledging that the most important use for masks is for healthcare workers, and they have, for the most part, specialized masks called N95 masks. They also use surgical masks depending on what they're doing in their healthcare facility, what their job is. And it's most important that all of our healthcare workers have the masks that they need to do their very best job and be protected so that they can protect us. If our healthcare workers do not have their personal protection equipment, it is impossible for them to do their jobs, and that means it's impossible for the rest of us to be able to get the kind of healthcare we're going to need if we should become ill with any disease. So there's really no benefit at all for anybody in the public to need to go out and secure an N95 mask. They are in short supply. They're needed by healthcare workers desperately. And so I ask you, as you think about whether or not you want to mask up, please don't go out and try to get N95s. We need to protect that supply for our healthcare workers. But there may be a benefit, as CDC has been noting just in their conversations over the last couple of days, for the rest of us to use masks that are homemade. This can be a scarf, a bandana, or masks that are made out of pieces of fabric. What they do is they can prevent droplets from coming out of our mouths and potentially infecting others. Remember, this is a disease that's spread with respiratory droplets. Sometimes when you talk, some droplets can come out. If you wear that mask, especially now that we know you could be spreading even if you have no symptoms, you would reduce the number of droplets that are carrying a virus potentially from getting onto somebody else. But wearing a mask is not a shield, and it doesn't replace our requests that you stay at home, that you always are practicing social distancing, that you're using hand washing as your major means to make sure you're not infecting yourself after touching something or someone who may be infected, and that you're self-isolating and self-quarantine when it's appropriate. It's just another tool that we can add to our list of tools that are available to, again, help us prevent infecting others and help others from preventing us. So as a reminder, surgical masks, N95 masks, those are needed by essential workers and by healthcare workers. But it may be appropriate when you go out and you're going to be in contact with other people. So this is really if you're going to the grocery store or you're going to the pharmacy. It may be appropriate for you to actually cover your mouth and nose, but you could do that easily with a bandana or a scarf or making a mask out of a piece of cotton fabric. And we'll be putting up guidance on our site once CDC releases their guidance. These are times that we're living in that we've never anticipated and we really have never experienced. The COVID-19 pandemic and the orders for slowing the spread are unprecedented. And I want to thank everyone for doing their part. To our healthcare providers who are bravely at the front lines of this pandemic, thank you. To our essential workers who keep things running and continue to provide needed services, desperately needed services in our community, thank you. To our businesses, especially our small businesses and their workers, who are making enormous sacrifices to comply with our orders and our directives, I thank you. To the media who are currently reporting accurately and providing us all with crucial information on COVID-19, thank you. And to every single resident in LA County who's doing their part to slow the spread, even when it feels inconvenient, strange, and at times scary. We all thank you. The cooperation and sacrifice are amazing. LA County is truly a special community, and I'm thankful to be part of it. Keep doing your part and keep hope that what we're doing is slowing the spread of COVID-19.